Colin, thank you for joining us today. We are talking about self-prescribed medications here. So people, being a physiotherapist, you and me must have seen thousands of patients who always says that, I've taken over-the-counter medications, i.e. paracetamol, ibuprofen, simple dose of cocodamol. They never work for me. And I need to go for a highest dose medication from a doctor. But in my experience, sometimes simple over-the-counter medications works better. Can you give us your insight? How, in most of the time, for many people, the simplest form of medication helps, but why our group of patients do not get the best out of it?
I think the first thing I'd say to that, in answer to that, is that a lot of people don't fully understand the best way to take medications. So they may take a couple of doses of paracetamol and say, I didn't do anything, I won't take that anymore, I need something better. Or they may take it the wrong end of the day, or before food, or after food. And it's really valuable looking at how some of these different medications work as to whether you should take them after food or whether you should take them on an empty stomach to get the best effect out of them. What I would say with regards to what are called over-the-counter medicines, the ones that you can either buy in Tesco's or Superdrug, or that you need to go to a chemist to buy and the pharmacist has to be there. That's where you can get the solpadeine with 80 milligrams of codeine in it. I would say that a lot of people probably don't quite understand the distinction between non-steroidal tablets and other tablets.
Yes.
So when you see the adverts for Voltarol gel and Neuramol or whatever to clear headaches and the like on TV, then when I was working clinically as a physiotherapist, I found that a lot of people didn't realise that Nurofen actually is an anti-inflammatory, and that comes with a whole range of potential issues down the line. And they think of it just a painkiller, just like paracetamol or anodine or codeine, and also they probably potentially don't grasp that some of the selling techniques. So Paramol, for example, as the new big painkiller on the block. If you look at some of the adverts, it's paracetamol and caffeine.
Yes.
It just works a little bit faster due to the caffeine, and it's actually just paracetamol.
My daughter is quite allergic to Paramol, but she's okay for paracetamol. I couldn't believe it. Is it the caffeine made the allergic reaction worse, or the paracetamol part of it made it worse? We went and saw the consultants, and they tested her all out, and she's perfectly fine. She's not allergic to Paramol anymore now. This allergic reaction happened 3 times. So, whoever watching this program, either on YouTube or listening while you're driving or running, please consult with a qualified clinician or a doctor or your pharmacist before you take any of these medications. Our intention is not to give you a medical opinion here, but we want to talk and clear some of the myths people go through. And, I've seen thousands of patients with the back pain and the neck pain. They straight away say, paracetamol doesn't work, I need tramadol. I'm thinking, oh my God, you can't go from, ladder 1 to 5th stages of the medication list. So saying that, my next question I want to ask you about, you talked about the timing of the medications. In certain conditions, for example, chronic lower back pain. For example, Mr. Jones having this chronic lower back pain for 5 years, but he's a carpenter and he's managing it with a reasonable painkillers here and there, is getting on well. Is there any way he can take it either before the meal, after the meal, or towards the evening, he can get the best outcome out of that medication?
What are you imagining this person is taking?
So he's taking at the moment low dose of cocodamol in the morning so that he can get through the day. Then he's taking ibuprofen around 4 o'clock. Then evening before bed, he's taking paracetamol. It's a cocktail of the drugs he's taking, everything. So it was a very interesting case I happened to see, and I have to streamline everything before we started with the treatment.
Okay. Well, certainly in the morning you'd want to have some food in the stomach before you were taking cocodamol, because it stops gastric irritation. Although there isn't a huge distinction, it's not going to block anything from absorbing or anything like that. What is important is his tea time dose. That the ibuprofen really does need to be taken on after food, because anti-inflammatories have this potential to irritate the gut, and you can end up with reflux or even ulceration at the worst outcome. And paracetamol, it doesn't really matter too much, so that's fine.
Would you say out of all these three medications we talked about, do you think paracetamol is one of the safest? At the same time, they are the least effective medication, or they have got their own, brownie point that it works in a different way, in a better way?
First off, I would say that no drug is safe. They all come with their own inherent potential risks. Paracetamol, for example, you really shouldn't take more than 4 grams a day if you're an adult. If you were to take as little as 12 or 13 in a day, then actually you run the risk of overloading your liver and potentially, worst case scenario, going into liver failure and dying 3 or 4 days down the line. So when you think that there are limitations to the amount of paracetamol you can buy, actually you can still do yourself significant harm with that. So all medicines need to be respected for what they are. Codeine or dihydrocodeine are useful pain-relieving drugs. But if they're misused, then they can become problematic in their own way. And all drugs have side effects. All drugs have interactions. Ibuprofen, sold as Nurofen, advertised on TV, you can buy it in Tesco's or in Asda. It has about 116 interactions if you look at it in the BNF. So all drugs need to be respected for what they are.
When I was in university studying my non-medical prescribing course, the first thing I learned, every drug is a poison we are putting through our mouth to create a negative effect on our systemic level, but it gives us a positive outcome to solve one of the existing problems, i.e. it could be a pain or inflammation, or it could be a joint problem, whatever it is. And but common people who believes that drug is very, very safe, I could take as much as I can, doctor told me 4, but if he's saying on a safer side 4, I could go up to 8 without harming our body. How do I pass the message to my patients saying that every drug comes with a huge potential complications? You are putting a poison into your body to expect the outcome. Hopefully it's a good outcome. How do we get the message across to them?
I think we have to be very, very clear and very straight, and encourage patients to take the medication they're prescribed as it's prescribed. So instead of missing the odd dose or doubling up a dose if they've missed one, then take the medication according to the prescription. That's going to be the way that you're going to get the maximum benefit, because it's actually written on the box.
Yes.
It's written as part of the prescription, and that's part of a plan. And if you're doing that with over-the-counter medications, then again, there's clear advice printed on the packs.
Yep.
So don't take stuff make up the how you take medications by something that you've read on Facebook or TikTok or Instagram
Your family
or
member
anything
told
like
you
that.
something about it.
Exactly. So listen to what the advice is. Have a read of the paperwork inside the packaging, and make sure that what you're taking is actually is first of all, is it safe?
Yeah.
There's safety and efficacy, and the safety comes first.
I always ask my patients, you don't need to keep it going until your problem solved. And you need to think about, am I still in need of this medicine? If you have taken for a week, this is a time you need to consult with a pharmacist or a doctor or any qualified professional before you carry it on further. The biggest challenge in my clinical practice, what I face, people take cocodamol, which is also available on the counter, over the counter. They feel addicted, but they do not think it is addictive drug. They keep it going for long term. How can, what the pharmacist or any prescribing professional should do to get this people to understand cocodamol can be addictive, shouldn't be taken for long term for a long standing problem of chronic back pain or a neck pain?
It's a big one, and I think I'd answer that by saying that yes, definitely, codeine is an opiate. Because what happens, if you take a codeine tablet, what happens is that your body rather magically turns it into morphine. So the active ingredient of your codeine
morphine
tablet is actually 10% of that is turned into morphine, which is actually the active agent. That's what gives you the pain relief. It's not the codeine or the dihydrocodeine. It's an active agent, which I won't bore you with a rather long name of. So as an opiate, yes, they have the potential for causing addiction. That's more likely to occur if you take it for an exceedingly long time, or if you overuse the medication and take it for longer than it's needed. So again, if you're buying stuff over the counter, it'll tell you don't take this for more than 3 days before consulting a healthcare professional. What I would urge people against doing is buying 3 days worth for themselves, getting their partner to buy 3 days worth, getting their friends to buy 3 days worth, and then taking the whole lot of 9 days worth and wondering why not all of a sudden they're getting a bit constipated, they're getting a bit low and can't sleep properly.
So this codeine is a bigger problem with the constipation and feeling dry and all those things. When I was studying, we know we need to drink plenty of water and high fiber diets and all sorts of things. Would you suggest some other alternative people can take which avoids or ease the side effects of the codeine?
Well, if the type of pain that someone is suffering from is effectively relieved by the codeine, then what you then need to do is adapt the diet or add another drug that's going to counter the side effect of the codeine. So the codeine will slow down the gut movement and make you therefore more liable to start to get constipated. And so taking short-term Senna will speed up that gut, and it'll counteract the potential for getting constipated, and also stool softeners as well. So Dulcolax, which again you can buy over the counter. So it's about managing the side effects. It's not a perfect world, and there are no perfect pain relievers.
Solutions either.
So, for example, with anti-inflammatories, you would normally think of, should I make sure that I'm protecting my gut at the same time when I'm taking them, especially if I'm going to be taking them for more than about a week or so. and that would be with an omeprazole type tablet. Again, you can actually buy 3 days worth over the counter. It's quite expensive, but it's available. There's that. Other medications out there other than that, it's difficult. I mean, there is one that is an equivalent to paracetamol that is called Nefapam.
Nefapam, yep.
But it's only available on prescription, and B, it's really expensive, and it's not much better than taking paracetamol effectively. So I'm not sure that it would necessarily get past the medicines management team at a trust if someone were to start thinking, oh, I'll prescribe Nefapam, because it's that expensive.
Earlier, I used to see so much of Nefapam get prescribed, and nowadays not at all.
No.
I think that makes perfect sense with the funding and the cost of the drug, isn't it? Thank you for tuning in so far. Let us talk about our main sponsor of this podcast, Excel Health. Excel Health is a highly specialized team focused on getting you back on your track so that you can enjoy your life without any aches and pains. If you are a person want to be independent in your own lifestyle or enhance your performance in your cycling or golf, any of your sporting events, or you're recovering from any of your injuries or pain, if you're looking for somebody to help you to get back on your track, we are the people. Excel Health have employed highly skilled physiotherapists, podiatrists, dietitians, and other healthcare professionals to get you back on your normal lifestyle. We have seen thousands of patients over the months with a chronic neck, back, or any joint pains, and also with the loads of medical ailments, which limits people's performance and quality of life. People often struggle to sleep with the aches and pains. If you want to get back to your normal sleeping pattern and get back on your golf course or cycling, or even if it is simple task as getting your grandchildren to school and back, and to be independent, you need to look for a partner that is from Excel Health. At Excel Health, we always use state-of-the-art tools for our trade, and also all the clinicians are highly experienced with years of experience under their belt. They've been using manual therapy, hands-on treatments, soft tissue massage and mobilizations, and all these things will enable you to get back to your normal life. When I say normal life, just normal pain-free sleep, walking from home to the school with your grandchildren or children, or rolling over at bed at nighttime, or cycling, golfing, any of those things which you consider as a normal life. And also, we are highly experienced with all the medical knowledge which needs to differentiate whether it is just a simple sciatic pain or a complicated medical problems underlying. We would differentiate it for you. I know finding a physiotherapy provider is not that easy. There are a couple of choices out there. But if you're looking for somebody who are highly experienced, specialized in the field, and also a very friendly team you want to work with, not looking forward anywhere, just contact us at Excel Health. Our main phone number is 01795 60 60 66. If you want to be up to date with what we do, just follow us on all the socials we have, which will be on the description and on the bottom of this video. And looking forward to helping you to get back to your normal life. Now, it's time to get back to our podcast. The next point I want to talk about, we cannot go anywhere without discussing this problem when we are talking about self-prescribing or self-medicating. It's often that our client groups do buy it from their parents or friends and relatives. They start simple, the habit then slowly shoots up. They go into other drugs. I've seen people taking tramadol from their families who started with cocodamol. Then they're going into morphine. Oh, my nan had some in the cupboard. Oh, just pay £100 to get these medication on the hand. What risk these group of people running, which ruins their body?
Gosh, the principal risk, if they're doing like that, if they're doing stuff like that, is that they actually run the risk of dying, because all these tablets that you've just mentioned are opiates,
Yes.
strong opiates, and opiates by definition will reduce the activity of your respiratory center, the center in your brain that stimulates you to breathe.
Absolutely.
And that's the most common cause of death in opiate overuse, that people will actually just stop breathing. And that's how they die. And it's really sad.
That is a principal problem, depressed respiratory center action, and they cannot breathe effectively, and they feel constantly, drowsy feeling, and that's not nice to be in.
No. And if you're constantly drowsy, you're tired out all the time, what impact is that going to have on your mood?
Yes.
And your mood becomes depressed. If you're sourcing your medication on the street like this, then you also run the risk of what are you going to buy to stimulate that? Amphetamines.
Yep.
Are you going to take some cannabis and some weed and stuff, and
goes
you're
on,
down you're down this spiral of high risk taking. And so my message for anyone who's watching this is don't do this. It's not worth it.
It's not worth your life.
It's extremely dangerous.
And, the mental health problem and depression, stress, everything is getting well recognized. What I feel nowadays, I'm educating people to go and talk to their families and friends and go out often as possible, so that they do not rely on these over-the-counter medication, which can do potentially so much damage to their own body and liver. And what else our NHS can do to enhance the mood of the population or the people, and what else mental health support we can offer, or where can these people go and seek support?
I wish I had an easy answer to that. I think that the NHS is highlighting a lot of good things, and there is an increased awareness of the importance of mental health and good mental health as a balance to well-being and enjoying good health overall. But the attached to that is the greater awareness amongst the general public of the importance of mental health, and we've seen that in celebrity shows, Love Island, for example.
Yep.
I've never watched Love Island, I have to say, but
I've heard of the name often.
You can't miss it, can you? You can't miss it. The more aware people are of needs for mental health, the more pressure there is on a public health system. And what I think we're finding is that GPs are being overloaded, primary care system is being overloaded, and we don't have the mental health facilities and specialists who can actually manage, which is why we have base level counselling available with the IACT system and the talking therapies. But it's very much a baseline intervention, whereas I think a lot of people are becoming aware that they have this problem or that problem, and they don't quite know how it's interacting with the rest of their life. I think we've made huge roads from where we were 30 years ago. I think we've got a long way to go.
I think these drug problems, self-medicating problem is far higher in America when you compare it to Europe or UK. But I think the education level is far better in UK. But still, people rely on some of these self-medicating tactics so often. And do you think we need to innovate further methods or tactics so that we connect to our patient groups easily, so that these problems can be eradicated in the future.
I think, talking about the difference between the UK and the US to start with, the big difference here is we have a general practitioner. So we have a gatekeeper.
Gatekeepers.
And a system where I can log on to someone's summary care record and know the medication that they're taking with reasonable accuracy. And so anyone who prescribes will inform the GP, and that will get updated. Whereas my understanding in the States is that you can go to see one physician and then book an appointment with another physician, and then perhaps a dentist or another physician or another prescribing person, and none of them actually talk to each other. It's the classic example of my understanding of how Elvis Presley met his death.
Yes.
The night before, he literally visited a dentist and sent out for more high-level opiate painkillers, and then sent out to the pharmacy for another collection, and then another collection because he wasn't sleeping right. So he had loads of tablets. He had 4 lots, and not surprisingly, guess what?
Respiratory arrest or depression.
More to do, I think, with the fact that he was totally. No, you don't want to know the gory details, but he had a heart attack. Let's put it that way, on the loo. But I think that that's one thing from that aspect. I think the system we have over here is better. I think the downside is that we're importing a lot of stuff from stateside. So we're importing the celebrity endorsements. People are increasingly using social media such as TikTok or Instagram, and people are actually selling stuff on there. And what's the phrase? Influencers.
Yes,
now
influencers.
we have influencers, and so these people will be advocating.
Yes.
For some type of approach to healthcare at times. And so we need to be very careful about who we're listening to. And we need to hold the ability to think critically about what we're hearing and what we're reading. Just because something says something on an advert doesn't necessarily mean it's true. Just because a celebrity is endorsing or is endorsing some type of agent, it doesn't necessarily mean it's right for you. And I think we need to get back to just having that ability to think independently and to think critically about what we're listening and what we're reading and what we're being told.
Perfectly there. And my understanding in compared to US and UK, in US when you go for just 2 paracetamol or ibuprofen tablet, you need to buy a big pack which will have minimum 50 tablets in there. But in UK we will not get that level of drugs on our over-the-counter medicine. It's completely different. But as you rightly said, we have a far safer mechanism in UK. If people are buying these tablets regularly, the pharmacists are very, very good in questioning these people and challenge their behaviors of repeatedly using these tablets. Many of the time I get to hear from my patient group, I cannot get to see my doctor. What do you expect me to do? I always tell them, your pharmacist, which is, on the pharmacy is on the corner of your street, they are highly qualified, well-educated people, and you can always sit with them for 10-15 minutes, show all the medications you have. They'll guide you which one is the right one to take, which is not supposed to be taken. So I don't want my client group to think that taking over-the-counter medicine or self-medicating is safe enough altogether. And they are definitely running the risk of damaging their liver, their gut system, and finally, their respiration may not work as good as it should be, and the risk is so high.
I think if you've got something new that's happening to you, then it's all well and good to try and self-medicate for about a week. If that hasn't helped, and you're still getting the same problem, the same symptoms, and maybe it feels a little bit worse, then don't hesitate. Go and see your GP. Go and make an appointment. Fill out one of those pesky e-consults. I know how painful that is. I've done it myself. But fill it out so that you can get a phone call in the first instance. You might see your GP, you might see the nurse, you might see a first contact physiotherapist.
Yep.
It doesn't matter, because all these people will be working together within the primary care system, and then you'll have the capacity to actually take a step forward.
Yes. Finally, Colin, you will teach this in your university and to your students, and mostly your students are out in the community working. What are the 3 don'ts you would teach out to our clients?
Don't borrow your partner's or parents' or friends' medication.
Absolutely.
Don't use medication in a way that is at odds with the advice on the packaging. And don't buy stuff from your friend in the pub.
Effectively, don't buy it on the street.
Don't buy it on the street.
And that may not be a genuine drug either.
Because you don't know what's in it.
Yes,
if you're buying it on the
absolutely.
street, you don't know
Where it's coming from.
Is it really tramadol? It might not be. It might be sort of half tramadol, half chalk dust. So it's not risky. It's not worth the risk.
Absolutely. Please don't borrow medication from your parents, family, and never ever buy it on the street. It is far safer. You can wait and talk to your doctors or the pharmacists. They'll guide you far, far better. And don't take it just willy-nilly. Use it very wisely. Even though they are over-the-counter medication, they can do enough harm to you.
We have very good organs at getting rid of drugs. It's called the liver and the kidneys. But if you overload these organs, then it's not great, because we need them to live.
For our entire lifetime.
Exactly. And we only get 1 liver,
Yep.
and we only have 2 kidneys.
Yes.
So it's always a good thing to respect them and to not make them work too hard. Respect the drugs that you're taking. Take it in accordance with advice. And if you're not sure how to take it, ask a pharmacist, ask your GP if you can get hold of them.
Colin, thank you very much for this informative conversation, and we are looking forward to seeing you on another episode.
Thank you.
Very welcome.